Welcome to today's deep dive. We're going to be looking at the healthcare system in Bihar, India.
Okay.
A place so rich in history and culture, but also, dealing with pretty intense poverty.
Yeah.
And this obviously, has a direct impact on the health of the people there.
Right.
So by taking a look at how their healthcare system functions, we can gain some pretty insightful perspectives into, the interplay between government policies and private initiatives and the day-to-day realities that millions of people face there.
Right. Bihar is a really interesting case study, I think.
Yeah. So
it's a state with very limited resources.
Yeah.
But they're still striving, to provide healthcare to a very large population, over 80% of whom live in these rural areas.
Wow, 80%.
Yeah.
So, that must be incredibly challenging.
Logistically, just trying to get healthcare out to all of these people.
Yeah.
It's pretty amazing.
Yeah. So, let's talk about the government then. It seems like they're kind of running the whole show when it comes to healthcare.
It seems that way.
From small village clinics all the way up to the big hospitals.
Right.
What does that actually look like on the ground?
So the government really is the main provider of healthcare in Bihar.
Wow.
They've put a lot of programs in place, to reach these rural areas. One of them is this National Rural Health Mission.
Okay.
Back in 2005.
Okay.
And this program, has helped, for example, to reduce infant and maternal mortality rates.
Oh, that's great. So they are seeing some progress.
They are, yeah.
Are there any other programs in place to help people access healthcare?
Yeah, definitely. So one of the biggest is it's a national program. It's called Ayushman Bharat.
Okay.
This is India's flagship health insurance scheme.
Okay.
And this program, it's really trying to reach those poorest families.
That's good.
Provide some financial protection, if they need to see a doctor.
Right.
And then at the state level, you have the State Health Society of Bihar. They're managing all the money and figuring out partnerships, and they even encourage public-private partnerships.
Oh, interesting.
So they're kind of like the conductor, right?
Yeah.
Trying to get all the pieces working together.
Okay. So tell me a bit more about these public-private partnerships. What does that actually look like?
Sure. So a good example is their work with the Bill and Melinda Gates Foundation.
Interesting.
The Gates Foundation is actually working with the government in Bihar.
Wow.
Focusing on things like maternal health,
Okay.
child nutrition, and even TB control.
Wow.
They're bringing in expertise and resources, to support the state's efforts.
That's great. It sounds like the government's really making a big effort to, improve things.
They are.
But I'm sure there's some really big hurdles still.
Absolutely.
Just getting quality healthcare to a largely rural population over such a big area.
Yeah.
That's going to be a huge challenge.
Huge.
Yeah.
Yeah, so funding is a major problem, I would say. Bihar actually spends less per person on healthcare
Really?
than almost any other state in India.
Wow.
And even when they have the money,
Yeah.
there are all these bureaucratic issues.
Oh, so they can't even really use the money they have.
It's very difficult, yeah.
Oh, wow.
Yeah, and then you've got infrastructure problems.
Right.
So in 2022, there was this report that came out,
Okay.
and they found over 70% of the primary health centers in Bihar, they don't even have a medical officer.
So they don't have a doctor.
They don't have a doctor.
How do you run a clinic without a doctor?
That's a good question, right?
Yeah.
And a lot of these centers, they don't have basic things like electricity or basic medical equipment.
That's hard to believe. It's like going back in time.
Yeah.
So, with all that going on, it can't be easy to attract doctors to work in these conditions,
No, it's very hard,
especially in rural areas.
especially in the rural areas, yeah.
Yeah.
The doctor-patient ratio in Bihar is actually pretty shocking. It's one doctor for every 43,000 people.
Wow. That's a lot of people for one doctor.
That's a lot of people.
Yeah.
And the World Health Organization, they recommend one doctor for every 1,000 people.
Wow. That's a big difference.
But a huge gap. Yeah, the pay is low, the working conditions are hard, and there's not a lot of room for professional growth.
So it's not very appealing.
It's not very appealing, no.
And this must have a serious impact on people's trust in the system.
It does, yeah.
If they can't even get reliable care.
Yeah, a lot of people in Bihar just see these government facilities as unreliable.
Yeah.
Long waits, no medicine. Sometimes the staff isn't there.
Right.
So they end up going to these private clinics instead,
Okay.
which of course costs them money
Yeah.
and puts a bigger strain on their finances.
So it's like a double-edged sword.
Exactly.
So let's talk about those private clinics then.
Okay.
What's their role in all of this?
So they're really filling in the gaps, I think.
Okay.
They're offering faster service in a lot of cases.
Yeah.
Sometimes the facilities are better.
Right.
They even participate in that Ayushman Bharat scheme that we talked about.
All right.
About 20% of the hospitals in that scheme are private.
Oh, that's interesting.
Yeah.
So they're actually serving the lower income population too.
You would think, but it's more complicated than that.
Okay.
Only about 140 out of the 700 hospitals that are registered with Ayushman Bharat are actually private.
Oh, really? So why aren't more private hospitals getting involved? Is it just about profit?
It's definitely part of it. The government reimbursement rates for this Ayushman Bharat, they're pretty low.
Okay.
So a lot of hospitals, they just can't afford to take a lot of patients at those rates.
Right. I can see how that would make sense.
Yeah, so it's tough.
Yeah.
It's social responsibility versus financial reality.
Exactly. But what about the quality of care in these private clinics? I mean, is there any way to know if they're meeting standards?
So that's where it gets a little tricky.
Okay.
The private sector in Bihar, it's not that well regulated.
So it's like the Wild West out there.
Kind of, yeah.
Wow.
You got some great private clinics
Yeah.
providing excellent care.
Right.
But then there are others that are cutting corners, overcharging, or even, recommending treatments that people don't need.
Wow. So it's kind of a gamble then.
Yeah, you really don't know what you're going to get.
You don't know.
And that makes people trust the system even less.
Right. Of course.
It makes them hesitant to go anywhere, whether it's a public or private facility.
Yeah.
And that can be really dangerous.
Of course. And I imagine geography plays a role too.
Absolutely.
Setting up a clinic in rural Bihar, I mean.
It's hard.
You've got bad infrastructure, people don't have a lot of money, and it's hard to get resources.
So most of the investment goes to the big cities.
Of course, it all goes to Patna.
Yeah.
Makes sense. So we've seen the government's role, and we've seen what the private sector is doing.
Mm-hmm.
Where do we go from here? What's the path forward?
That is the big question.
Yeah, I mean, how do we even begin to solve this healthcare crisis in Bihar?
Yeah, it's really complex.
Yeah.
We need a multi-pronged approach.
Okay.
For the government, I think it's about addressing those core issues.
Okay.
More funding,
Yeah.
better staff training,
Right.
making those existing health centers actually work.
It's like you have all these tools, but you don't know how to use them.
Right, exactly.
You have the buildings, but they need the right equipment. They need staff. They need to be able to give consistent care.
Exactly.
Right. And what about the people in those really remote areas?
Yeah, that's where we need to get creative.
Okay.
So things like telemedicine could be really helpful.
Oh, yeah.
Connecting patients in those remote areas
Right.
with doctors in the cities.
Yeah.
Or maybe setting up mobile health camps
Oh, I like that.
to bring services to the rural communities.
Yeah, those are great ideas.
Yeah.
Especially for a place like Bihar, where most people live in rural areas.
Yeah.
But what about getting the private sector more involved?
Yes.
Especially in those underserved areas. I mean, they have a big role to play too, right?
Huge role.
Yeah.
We need to make it worthwhile for them to invest in rural healthcare.
Okay. How do we do that?
So maybe we could offer tax breaks.
Okay.
Maybe we could give them better reimbursement rates under that Ayushman Bharat scheme.
Right.
Or maybe even help them with infrastructure
Okay.
in those rural areas.
So basically, we need to make it less risky for them.
Exactly.
Make it more appealing.
Right.
But it can't just be about individual efforts, right?
Yeah.
It feels like the public and private sectors need to work together.
Collaboration is key.
Yeah.
We have to create a system that's sustainable and equitable.
Right.
And we've seen it work before.
Right.
There's a TB control program in Patna.
Okay.
It's a partnership between the government and private clinics,
Okay.
and it's been really successful.
Oh, that's good.
They've seen a huge increase in case reporting. Treatment success rates have gone way up.
Wow.
Imagine if we could do that all over Bihar.
That would be great.
Yeah.
And ultimately, I think it comes down to trust.
Trust is everything.
Yeah.
We have to rebuild that sense of confidence in the system.
Both for the people who need care
Yes,
and the people providing it.
exactly. When people trust the system, they're more likely to go to the doctor when they need to.
Right.
They're more likely to follow their treatment plans,
Yeah.
and they're more likely to, do things to prevent getting sick in the first place.
So it's a win-win for everyone.
It's a win-win.
Yeah.
It creates this positive cycle. More trust, better health outcomes.
But that takes time
It takes time.
and a lot of consistent effort.
Absolutely.
And it's not just about fixing the buildings and the equipment.
Right.
It's about fixing those deeper problems that are causing this lack of trust.
And transparency is really important.
Yeah, that's a good point.
People need to see that the money is being used fairly.
Right.
And that the system is accountable.
Makes sense.
When people see that, it builds trust.
Yeah.
And it makes them want to get involved in improving health outcomes.
It's about feeling like they have a voice.
Exactly.
Like they're part of the solution.
Right.
But it's not just about systems and structure.
No.
It's about people too, right?
It's about people.
We need to invest in the people who are working in healthcare, especially in those rural areas.
Absolutely.
Yeah.
We need to train them.
Yeah.
We need to support them. We need to give them opportunities to grow professionally.
It's about empowering those individuals.
Yes.
And those communities.
Right.
To really take charge of their health.
Exactly.
Yeah.
We need to teach people about health.
Yeah.
We need to focus on preventing illness.
Right.
And we need to create programs that work for each community.
Programs that are tailored to their specific needs.
Exactly. It's about sharing the responsibility for health outcomes.
Right. Everyone has a role to play. So Bihar could be a model
It could be.
for other developing regions.
Absolutely.
If they can make these improvements, even with all these challenges,
Yeah.
it could inspire other places.
It could be a blueprint
Yeah.
for how to build a healthcare system that puts people first.
Especially the most vulnerable.
Especially the most vulnerable.
It would give people so much hope.
So much hope.
Yeah.
It would show that it can be done.
It won't be easy, of course.
No, it won't be easy.
There will be setbacks, there will be challenges,
There always are.
but the rewards are worth it.
Absolutely.
So we need to keep talking about this.
Keep the conversation going.
We need to learn from our successes.
And our failures.
Yeah, we need to share what we know.
Share best practices.
Support the people who are doing this work.
Absolutely.
It's a long journey.
It is.
It takes collaboration.
Innovation.
And a real commitment to improving the lives of the people who have been ignored for too long.
Yep.
It's about recognizing that healthcare is a human right,
It is.
not a privilege.
It's a race.
It's something everyone should have access to, no matter how much money they have, where they live, or their background.
Everyone deserves access to healthcare.
So as we go deeper into this discussion,
Yes.
I have a question for you.
Okay. What role can each of us play in supporting this idea of health equity?
Yeah, health equity, not just in Bihar,
Right.
but in our own communities too, even around the world.
Exactly.
So as we wrap up this deep dive into Bihar's healthcare,
Yeah.
what are some key takeaways that you think our listeners should really hold on to?
Well, I think the first one is just how big this challenge is.
Right. We've talked about limited resources,
Mm.
geographical barriers, and this deep problem with trust.
Mm-hmm.
But it seems like even within those challenges, there's opportunity
Yeah, I think so.
for innovation.
Definitely.
It's almost like we're looking at this giant puzzle where each piece represents a different part of this healthcare system.
Right.
We have the government,
Mm-hmm.
we have private companies, NGOs, international organizations, and then, of course, the people themselves.
Of course.
So finding the right way to make all those pieces fit together, that's the key, right?
Yes.
To building a system that's effective and sustainable.
Yeah, and I don't think it's just about copying what other places have done.
Right.
What's exciting about Bihar is that they could come up with solutions that are unique to their situation.
Yeah, that's what's so inspiring about this whole story.
Mm-hmm.
It's not just about fixing what's broken.
Right.
It's about creating something totally new,
Yeah.
something better,
Mm-hmm.
that could really be a model for other regions that are struggling with the same issue.
Absolutely.
So I think it all starts with awareness.
Mm-hmm.
Our listener now knows a lot more about what's happening with healthcare in Bihar,
Right.
and they can actually become an advocate for change.
They can.
How can they take this knowledge that they have now and actually turn it into action?
Yeah,
What
yeah.
can they do?
Well, I think one thing they can do is support organizations that are already working on the ground in Bihar.
Okay, yeah.
Even small donations can make a big difference.
Yeah, for sure.
Whether it's providing medicine, training healthcare workers, or supporting community health programs,
Right.
those donations can go a long way.
And it's not just about money, right?
No, not at all.
I mean, spreading awareness, just sharing this deep dive with other people, that can spark conversations and get people thinking about this issue
Exactly.
and inspire them to take action.
Absolutely.
And we can also try to influence policymakers, right?
Oh, yeah.
Encourage them to put healthcare funding higher on their list of priorities to address those systemic inequalities that we talked about,
Yeah,
and to support policies that make quality care accessible to everybody.
absolutely.
Because at the end of the day, it's about realizing that health isn't just a personal responsibility. That's right.
It's a societal responsibility.
It is.
We all have a role to play in making sure that everyone has the chance to be healthy.
We do.
And that brings us back to that question that you asked earlier.
Okay.
What role can each of us play in supporting health equity? Not just in Bihar, but everywhere.
Everywhere.
It's a question we should all be asking ourselves.
We should.
I mean, think about the healthcare systems in our own communities.
Yeah.
Where can we do better?
Mm-hmm.
What can we do to make things more equitable?
What can we do?
Maybe there are local organizations that are already working on these issues.
Mm-hmm.
Maybe we could volunteer at a clinic.
Yeah.
Even small actions can have a big impact if enough people do them.
They can. And I think it's important to remember that even when things seem really tough, there's always hope.
There is.
There's always a chance to make things better.
Always.
And Bihar, I think their story shows us that.
It does.
It's a story about resilience,
Mm-hmm.
innovation.
And a commitment to improving people's lives.
Even when it's really hard.
Even when it's really hard.
So to our listener, as you continue to think about this issue,
Mm-hmm.
stay curious.
Yeah.
Keep asking questions.
Keep learning.
And never underestimate how powerful your voice can be
Your voice matters.
in advocating for a healthier, more equitable world for everyone.
It does. Thank you for joining us on this deep dive.
Yeah, thanks for listening. We hope this has made you think
Mm-hmm.
and inspired you to keep exploring this important issue.
It's a critical issue.
So until next time, keep learning, keep asking questions, and keep fighting for a world where health is a right.
A right, not as a privilege.
Not a privilege.
It is a right for everyone.
And until next time, keep learning and keep asking questions.
Yeah?
And keep up the fight for a world where everybody has that right to health.
Absolutely.
Not a privilege.
A right, not a privilege.
That's it for today's deep dive.
Thanks for listening.
We'll see you next time.